Welcome back, friends, to TV5 News at 9. Joining us this morning is Dr. Omar Gayar. Thank you so much for being here. How are you, doctor?
I'm great. Thank you for having me. How are you?
Of course, I'm doing well. Thank you for asking. Today we are talking all about proton therapy for lung and thorax cancer. So, doctor, how common are lung and thorax cancers?
So there's quite a few thoracic tumors and cancers, including lung cancers, esophageal cancers, and otherwise thymomas. You can even have some lymphomas within the thorax. Lung cancers in particular are quite common. In fact, one of the most common cancers that can occur, especially for smokers, as smokers are at special risk for developing lung cancers.
And doctor, who is most susceptible to these cancers?
Yeah, as mentioned, smokers I think are the biggest ones that are at risk for developing these, or anybody with significant exposure to secondhand smoke as well is at risk for this as well.
Yeah. And doctor, why might proton therapy be such a good treatment option for these cancers?
Yeah, so proton therapy is an excellent option for radiation therapy. The way that it works is that it's a very targeted method of delivering radiation therapy to actually target the tumor and actually help significantly reduce dose spread to surrounding organs and structures, and that therefore can actually help reduce side effects during the course of the radiation treatment and reduce the risk of long-term complications. This can potentially make the radiation process a lot more tolerable for people going through the radiation therapy and help reduce the risks for long-term complications as discussed. In particular for thoracic tumors, there's quite a few critical structures within the thorax, the chest area, including the heart, esophagus, spinal cord, things you really don't want to damage with radiation therapy. And we do everything in our power to help reduce that, and proton therapy can help us to significantly protect that while we're treating cancers of the thorax. And in particular can be very helpful, especially with patients who are undergoing radiation therapy a second time around, where those structures may have already been exposed to some radiation therapy, and we want to help protect them even further.
Because it's a very precise treatment, is that right? Very targeted.
Oh, absolutely, absolutely.
Yeah. Doctor, let me ask you this. Is there anything else that you'd like to share about lung cancer or thorax cancer or proton therapy that we haven't covered?
Well, it's just, obviously if anybody's a smoker, I think as mentioned, that's the most critical thing that puts you at a high risk. So check with your doctor to make sure if you're not a candidate for annual lung screening CAT scans to be able to catch lung cancers early, as obviously catching it early puts you at a higher chance of cure, essentially, when we catch it earlier rather than later. And as always, if you feel like you have a cancer or a case that you'd like to be reviewed to see if radiation or proton beam therapy is right for you, contact us at Hermanos McLaren, and we'd be happy, I or one of my partners would be happy to review your case with us. You can contact us at 855-MY-PROTON or mclaren.org/proton treatment. We'll be happy to review your case and see what's right for you.
It's perfect. Anything else? We appreciate you bringing this information to us today. Thank you so much.
Absolutely. Thank you so much for having me again.
Of course. You're so welcome. And thank you again, viewers, for watching. You can find more information in the hot link section at WNEM.com.